Angina, red or white, duration, causes, contagion, and treatments. Angina is an inflammation of the throat and particularly of the tonsils. We sometimes speak of red or white angina depending on the appearance of the tonsils. As a region of the sore throat and difficulty swelling, angina is sometimes accompanied by fever. It has a viral, most often, or bacterial origin. Depending on the diagnosis of its origin, virus or bacteria, the necessary treatment will be different. Summary: what is angina? The two types of angina. What are the symptoms? Other forms of viral angina consultation in case of angina is angina contagious, prevention of angina. What is angina? Angina is an acute inflammation of the throat, not just the tonsils. There are two types of inflammation. Tonsillitis, when inflammation predominates over the tonsils. Pharyngitis, where the inflammation is more extensive. The main problems is with angina is whether or not it is due to beta hemolytic streptococcus responsible for subsequent cardiac complications, acute articular rheumatism or AAR, and kidneys, acute glomerulonephritis or GNA. In this case, antibiotic treatment is necessary. The two types of angina. Today, the angina is most often between 50 and 90% of cases viral and benign. They are therefore caused by the viruses. Antibiotics are not effective against this type of angina. Bacterial tonsillitis is mainly caused by a bacterium called beta-hemolytic streptococcus group A. What are symptoms? In both cases, the pain in throat is first squeezing type, hence its name, which comes from the Greek order to squeeze. Angina red. In erythematous angina, the throat is uniformly red. It is an acute inflammation of the pharynx which shows a mucosa that is redder than normal. It occurs more often in children and results in intense pain when swelling, migraines, fever. Angina blank. When angina, white angina is actually erythromatopultaceous. This complicated word simply means that the throat is red and white. Indeed, a grayish-white pultaceous coating sprinkles the tonsil with white spots. The symptoms are the same: a sore throat, fever, migraines. The difference only related to the presence or not of the pultaceous coating has no pejorative importance. The germs in question are same. Group A beta hemolytic streptococci, along responsible for serious post-infection complications, can be the cause of both types of angina. In both cases, we repeat the symptoms are identical. E also has on roaches something. Other forms of viral angina. In fact, the vast majority of angina are of viral origin in children. Herpangina due to Coxsackie virus occurs in children under 7 years of age in small summer epidemics. The onset of symptoms is often brutal and body temperature can reach 39 degrees centigrade. There are vesicles on the throat, palate and palate. When they burst, they leave smaller, regular rounded ulcerations. Foot hand mouth syndrome. The Coxsackie A16 virus causes a very characteristic foot hand mouth syndrome, small blisters in the mouth that quickly will to give way to ulceration. At the same time, there is a reaction on the palms of the hands and the soles of the feet. Adenovirus angina. Adenovirus APSC angina is associated with conjunctivitis and rash. Angina with infectious mononucleosis. The angina of infection mononucleosis is often false. Membranes, the pultaceous coating thick and confluent, can give the impression on examination of grayish and necrotic membranes. The breast is foul, the neck or the constant. The general signs are marked: fever, asthenia, a reduction and eruption, a discrete yellow tint of white of the eyes, and enlarged skin. Blood test allows the diagnosis of antibiotics are contraindicated because they can trouble some rash. Consultation in course of angina. Consultation with geriatry. The fever is high, the onset is brutal, the feeling of discomfort in case of sharp cringing pain. In case of isolated angina without nasopharyngitis, obstruction with runny nose, laryngitis or tracheitis. Doctor will suspect that streptococcus will have a throat trafficking. Nose lands in the neck and is put down. Treatment. Classic care. Treatment consists mainly of monitoring the fever, treating it, and giving plenty to drink. There are a low number of drugs which are combinations of products intended to reduce pain and or limit bacteria by local or general action, local sprays, lozenges, etc. And angina, how to reconcile? Doctor commonly use medication. Doing hot or cold wraps around the neck can also help. In case of constipation, if he suspects streptococcus, the doctor will be prescribed antibiotic based on penicillin, erythromycin in case of allergy for 8 to 10 days. Event of frequent recent recurrences of bacterial febrile angina for 2 years or 3 episodes per year for 3 years. Surgical removal of the tonsils may be proposed from ages of 4 to 5. Now to give an antibiotic without being prescribed by the doctor. Prescribed antibiotic aim for sugar and tonsils. Beware of self-healing. It is also possible to create a fever diagnosis, but if one suffers from the throat and hair in the eyes, one series to red tonsils covering yellow flakes or small white dots, you must avoid drug emergency that can get vertical condition is required. Contagious whether bacterial viral angina contains disease that is transmitted through infected droplets, coughing, sneezing, or sputtering, or spoiled. It is therefore necessary to respect barrier gestures. Prevention of minor angina. To prevent the appearance of angina or to limit the transmission of the disease, some hygiene measures are needed. Wash your hand regularly with soap and water. Use hydroalcoholic solution. They are effective in eliminating many transmissible microbes. Using single-use paper tissues. If you cough or sneeze, use a tissue and how throw it away immediately. If you don't have a handkerchief, cover your mouth and nose with your sleeve at the elbow crease. If you are contagious, avoid approaching fragile people, babies, sick, or elderly people. Possibly wear a mask. Avoid direct contact during angina. Do not kiss your loved ones. Do not shake hands. Do not share body objects within linens. Clean every body object such as children, toys, computer, keyboards, mobile, etc. Ventilate your home at least once a day for 20 minutes.